Hello, myself Dr. Smita Patil Zope. I am a pediatric neurologist practicing in Kalyan, Dombivli and Thane. On the occasion of World Autism Awareness Day on 2nd April, today I am going to talk to you about autism. Many parents have heard the word autism, but they don't know what is autism. Basically, autism is a constellation of signs and symptoms where the child is not able to communicate with either with his peers or with his parents. And apart from these communication disturbances or communication difficulties, it may also show some other symptoms like repetitive movements, rotatory movements. He may also indulge in certain other behavioral issues, like he may show temper tantrums. He may get irritable when he is exposed to new surroundings or crowded places. There are other sensory issues also. So what do you mean by sensory issues? Every human being has 5 special senses: vision, hearing, smell, taste and touch. So in these kids of autism, they may have sensory issues pertaining to these special senses. So when exposed to such excessive sensory inputs, like for example, if the child has gone to a noisy place or he has been exposed to a new environment, he may get devastated and he may run around restlessly, or he may start crying. He may even hit others, or he may hit himself, he may injure himself. So such kids are usually subjected to various tests for diagnosis of autism. So these tests are not like blood test or MRI of the brain. These tests are usually based on the interview of the parents, as well as depending upon the behavior of the child observed in the clinic of the doctor. So what we usually do is we call the child for examining. We take history from the parents, we subject the parent to certain questionnaires, and along with that, on the basis of what we are observing as the child's behavior, or how he is approaching a particular toy, how he is playing with toy, how he is communicating or trying to communicate with his parents as well as strangers. There are many studies which point to the etiology of autism. Few say they happen because of the nutritional issues in the mother when she is pregnant, as well as the nutritional deficiencies when the child is developing in his early life years. The child's brain develops fully by the age of 3 to 4 years. So if there are certain nutritional deficiencies in omega-3 fatty acids, vitamin D, certain minerals, these deficiencies can affect the child's speech and language. It can cause impairments in their intellectual capacities. And not only that, if the mother has been exposed to certain toxic elements by means of food or environmental exposure, other medical conditions in mother like diabetes, hypertension, excessive maternal age, all these things can affect the child's cognitive abilities as well as his developmental outcome. This is one of the factors. There are other factors also which are under research. These other factors include genetic problems, like there are genetic issues which can affect the child in his early development. And so that's why we say if the first child has autism, there is increased risk of having next child with the same symptoms. If we come across such a child, the doctors might prescribe for a genetic test if the doctor feels that the child is having genetic syndrome. What is the treatment option for autism? Autism is not a disease, it is a developmental disorder. So medicines are not the mainstay of treatment. It is the therapy part which is very helpful to the child to develop his full potential in his life. So therapy also has 2 parts. One can be occupational therapy and the other can be speech therapy. So what do occupational therapists do? They basically target the sensory issues in the child. It is called as sensory integration therapy. And with the help of those certain exercises as well as certain activities, the child's senses are calmed down. And the child stops behaving in a certain ways which are harmful to himself as well as to the other family members, as well as those unwanted behaviors are targeted. Speech therapist will take care of his speech issues, like if the child is not able to vocalize, if the child is not able to communicate with the help of speech. The role of the speech therapist is to improve the speaking ability of the child. So it will help the mother to take care of the child at home also. They will give you certain tips what activities could be done at home, and that will help the child to gain his speech outcome. There are other therapies also available like ABA, Applied Behavior Analysis. In these therapies, the child's behavior is assessed, and depending on those behavioral issues, the therapist will target those unwanted behaviors and help the mother how to overcome that particular behavior and teach her strategies to take care of all those unwanted behaviors. There are certain new recent therapies which are under trial. These include dietary therapies. One is ketogenic diet, other is gluten-free diet. These may help the kid in certain ways. I hope this information was useful to you. If you feel there is any such kid around you who is showing certain symptoms, you can refer to that child to your nearby pediatrician or a pediatric neurologist. Early treatment will help him lead a normal life as well as improve his quality of life and help him to become independent in his aspect. Thank you.